Are Republican governors killing their citizens to protect billionaires? The easiest and laziest way for a state government to deny its citizens a benefit to which they're entitled is to wrap it in so much paperwork, make people jump through so many hoops to qualify, that they give up in confusion or exhaustion. Texas Governor Greg Abbott, one of the nation's cruelest, he shipped refugees out of state based on lies, put a $10,000 bounty on the heads of pregnant women, and is alleged to have ordered his own police to throw children and nursing babies into the Rio Grande River where razor wire awaits them, is all in on this with regard to Medicaid. As the Texas Tribune reported this week, 500,000 Texans have lost their Medicaid coverage since April, mostly for procedural reasons like not responding to messages from the state. This is a big deal. 45,000 Americans die every year because they lack health insurance, including those who can't access Medicaid. The state could have easily confirmed their eligibility with public records. Most states do. But Texas Governor Abbott wanted people to have to jump through long, complex, confusing hoops. It would mean fewer Texans would have health insurance, which is explicitly his goal, and that of 10 of his Republican gubernatorial colleagues, including Ron DeSantis. And Medicaid is consequential. It covers roughly half of all American children, pays for 40% of childbirths, covers 1 in 5 parents, and is the largest funder of long-term care for the elderly. It's also a key funder of substance abuse and addiction treatment and covers more people than Medicare. The federal government covers 90% of the cost of Medicaid, and 39 states have expanded their programs under Obamacare to cover all low-income people within their borders. But 11 Republican-controlled states continue to refuse to insure their low-income working people except under strict rules that limit the insurance to small groups like those who are disabled. When the pandemic hit, the federal government forbade states from dropping people from their Medicaid rolls, but that protection expired in April, and in the months since then, Republican governors in those 11 states have been systematically stripping people of their insurance protection. None have been as enthusiastic to put their citizens at risk as Abbott's Texas. Roughly 45,000 Americans die every year from a lack of health insurance. Many uninsured people postpone medical tests and concerns until they're fatal. Others simply can't afford the cost of treatment or ongoing medications to keep them healthy or alive. Every one of these people has a story, a family who cares about them, friends and neighbors. Every one of these deaths, which don't happen like this in any other developed nation on earth, is a tragedy that is completely unnecessary. Every one of them dies because of choices made by Republican governors who hate the idea of billionaires having to pay income taxes to cover the healthcare costs of working class or poor people. In this, these governors subscribe to the all-American rich man's slogan of, "I've got mine and screw you." It was laid out in detail in 1980 when billionaire David Koch ran for vice president with the Libertarian Party, an organization created by the real estate lobby to give an air of legitimacy to their efforts to outlaw rent control and end government regulation of their industry. His platform included a whole series of positions that were specifically designed to roll back and gut FDR's big government programs, along with those added by both Nixon and LBJ's Great Society, that had created and then sustained America's 20th century middle class. The amazing thing is that his list reads like today's MAGA Republican agenda. Ending low-cost healthcare and gutting our public schools is just the beginning. We urge the repeal of federal campaign finance laws and the immediate abolition of the despotic Federal Election Commission. We favor the abolition of Medicare and Medicaid programs. We oppose any compulsory insurance or tax-supported plan to provide health services. We also favor the deregulation of the medical insurance industry. We favor the repeal of the fraudulent, virtually bankrupt, and increasingly oppressive Social Security system. Pending that repeal, participation in Social Security should be made voluntary. We propose the abolition of the governmental postal service. We oppose all personal and corporate income taxation, including capital gains taxes.